Facebook going, LinkedIn is going now. Thank you so much, first of all, for watching this video. This is probably one of the more important videos or lives that I've ever done. I wanted to bring a few things to the forefront. The point of this video is to shed light on the situation that's actually a national situation with a lot of local implications relative to the state of EMS. A lot of people don't think about EMS kind of in the same way that we do. Obviously, we're living in the middle of the COVID crisis like all of our other fellow healthcare workers are. So I just wanted to take a moment and ask for your help. We need this message to get out to your representatives, to the congressmen, people that you know, the news. Wanted to talk a little bit about some of the issues that we're facing. So my name is Josh Watts. I'm the CEO of MedTrust. We are a Charleston, South Carolina-based private ambulance company. And a lot of people really don't understand what private ambulance is, and so I'm going to talk just a little bit about that. But what we're really wanting to focus on today is the immediate and critical need that EMS has right now in order to be here to serve the communities that we're in. So there's $100 billion that's been allocated to healthcare as some of the recent legislation. And one of the things that is very unclear is how or if are those dollars going to be allocated. And right now we're asking urgently that the political powers that be move to immediately fund directly EMS. I'm going to talk about South Carolina specifically because it's something that I really know the numbers on and data on much better than some other areas. South Carolina has 2,200 ambulances in the state. 800 of those ambulances are actually county or municipal or 911 ambulances, which means that 1,400 ambulances, or 2 out of every 3 ambulances in South Carolina, are actually private ambulances. The reason that's important is that obviously 911 systems, fire department, police, they all have public subsidy, they all have tax funding. Certainly those things are challenged right now, but not in the same way that private industry is. So what we're asking for is that there be a consideration of the impact on the business that we do. A lot of people think we're unbelievably busy right now. The reality is the hospitals are empty. Many of the hospitals in the areas that we serve, and many hospitals around the country, are very low on census right now, and you may be wondering why that is. The reality is that hospitals, their entire business model is heavily dependent on elective procedures. Truthfully, it also has a lot to do with people that are maybe unnecessarily using an ER instead of another type of facility like an urgent care or their primary care doctor. But the combination of those two things has created hospitals that have anywhere from 30 to 60% bed availability in some markets. Now, certainly there are markets that are the exact opposite there, but all of the markets that we serve in South Carolina, Georgia, and Florida are in that similar place. Now, what does that mean? That means that MedTrust has 430 employees that are normally staffed to complete about 5,000 to 6,000 transports a month. Our current pace is around 3,000 transports a month, 3,000 to 3,500. The reason that's important is that our revenue and our pay and our wheels that keep things moving are heavily based on doing transports. Right now, because we're not doing the same number of transports, it's unbelievably difficult for us to remain a ready resource for the state, for the communities that we're in, for the hospitals when they eventually turn around and get busy again. One of the things that we don't have the luxury of is the same sort of clout that the hospital associations and the hospital lobby and the nurses lobby and the AMA and all of those different organizations have. So it's very important that the powers that be recognize the impact on EMS if there's not immediate and direct funding set aside for EMS and really in our hands within 30 days. Healthcare is a 60-day to 120-day revenue game, and what that means is that the work we did 2 months ago is actually what is funding the business today. So if you guys think about the timeline of COVID, the weeks and months to come are when this is going to challenge all sorts of healthcare providers The difference is there seems to be a lot of talk about direct funding to hospitals, direct funding to doctors' offices, direct funding to other areas of healthcare, but no one is talking about direct funding for EMS. The problem is we can't, in good faith, change our workforce. Sure, we manage the workforce, we manage the hours to try to match, the amount of demand that we have, but in reality, we have to keep these crucial members of the healthcare community employed. We have to keep them ready to respond. We have to do those things, and we need direct support to do that. Now, there's been a number of things proposed, a number of different models proposed, but if you think about the way that an ambulance company works, you are actually paid for readiness in many ways. And so if we don't have those transports, that is our revenue source, we still have the cost. So what I want to kind of point out a little bit is in South Carolina, we have 2,200 ambulances, 1,400 of those are private. Every year for the last 3 years, we've had hurricanes, we've had to evacuate people, and a lot of people don't realize this, but that's typically not the mission of 911. They're taking care of the residents, they're taking care of the emergencies that take place during an evacuation. MedTrust, with a bunch of other mutual aid partners, is primarily responsible for coastal evacuation. So if you don't have private agencies, you don't have a good evacuation model. So hurricane season's right around the corner. We really, really need support, and we need to be very strong going into that hurricane season so that we can protect our citizens. Some of the impacts that a lot of people aren't thinking about is the number of people that could be unemployed and therefore could be uninsured in the next 90 days. If that happens, that means that the transports that are being done by companies like MedTrust, they're not going to have a payer. Patients aren't going to be in a situation where they can pay that bill directly. So the trickle-down effect is not only is there not as many transports being completed, which again drives the business, but there's also less of those transports that are going to be paid. So what we're asking for is direct support, direct help. We need this information out to all of your representatives, Congress, the governor's office. If you have contacts with any of those offices, if you can get this in front of any of those people, please do that. We're happy to speak to the media. We're happy to really dig in and explain what's going in more. But we must be prepared, because the implications of not having private EMS around this country is that the entire EMS infrastructure will cease to exist. Now, I don't mean to be scaring people unnecessarily. Certainly there's programs that are available. They're very complicated, but they are available, and we are applying for all of those that we're eligible for. Our commitment is to navigate this and to be a resource for our communities on the backside of COVID, but to do that, we need your help. So thank you guys for watching. Please share this. If you have folks that would like to learn more about how they can help, how they can share this message, how you can help us in this fight. If you really want to help frontline healthcare workers, please consider helping frontline EMS. Thank you so much.